So I had a request from a nurse, a new hospice nurse, to do a video on transitioning from hospital nursing to hospice nursing. And her primary concern was that she was going to lose all of the skills that she had spent the last many years developing. Hey y'all, I'm Shelley. I do tips for hospice nurses. So this is what I'm talking about today, how we transition from hospital to hospice nursing. And I will tell y'all, when I first became a hospice nurse, it was completely by accident. I had been an ICU nurse for like 10 years, ICU and ER, and really didn't know much about hospice, and got into it because the local hospice was looking for a PRN nurse, and I wanted a side hustle that was outside of the hospital. So I started hospice thinking it would be easy, and thinking that I would be sitting with patients in these beautiful environments and holding their hand at the end of life, and it was all going to be lovely and sweet. So I know y'all are probably laughing when you hear me say this, because you know that's really not what it is and what we do. I quickly learned that. I also learned that it's where I belonged, and I ended up quitting my hospital job and doing hospice full time. But I will tell you the top 3 things that you need to understand when you're transitioning from hospital nursing to hospice nursing. Number 1 is that your critical thinking skills are going to be increased and honed for multiple reasons. The first reason is that you are working in an uncontrolled environment. You're not only meeting the patient's physical needs, but you're meeting their emotional needs and the emotional needs of the family, the caregivers, and everyone around the patient. And again, in an uncontrolled environment, which is a lot harder than it seems like. Also, you don't have the doctor downstairs that you can run and get to help you. You don't have the diagnostic test to look at. And that was one of the hardest things for me becoming a hospice nurse, is that I didn't have those tests to look at. So I wasn't sure what was going on with my patient. I had to use all of my critical thinking skills to determine what was going to be the best action for the patient. Number 2 is you're going to use a lot of your clinical skills. So sometimes people think that in hospice, we don't treat things, and that's not accurate. We treat everything the patient has in hospice. The only thing we don't treat is we don't provide active treatment for their hospice diagnosis. So if somebody's coming on with a cancer diagnosis, they're not going to be actively on curative chemo. But everything else we treat. So we have to figure out what's going on. You may be drawing blood. You may be taking other kinds of samples. You're going to be doing complex wound care. You're going to be doing drains, thoracentesis, paracentesis, sometimes a lot of abdominal drains in a lot of weird places because our patients have had lots of surgeries that weren't very, that didn't turn out well. And so there's a lot of things we're using, sometimes devices in different ways than how they were really meant to be, because we're trying to do whatever we can to provide our patient the best relief and the most dignity. So you got to have really strong clinical skills to be a hospice nurse. And then you also have to remember, again, you're in an uncontrolled environment. So you're performing those skills on a 400-pound patient all by yourself in a 12 by 12 room with no air conditioner, 14 dogs and 2 chickens, and that family fighting in the room next door. I mean, this is a real scenario. This is what our life is like every day. So you got to be strong in your critical thinking skills and in your clinical skills to meet that patient's needs in the very best way possible. And then the number 3 thing that you're going to really have to have really down good as a hospice nurse is your boundaries. Because just like in the hospital, there are some hospices, not all, but some, that are intentionally understaffing to increase their profits. And so they're going to try to pile a bunch on you. They're going to tell you, you got to work 12 hours a day. You got to see all of your patients, and then you got to go home and document, and you're not going to get paid for that because your salary. You got to say no to that. You got to say no if you're expected to work 5 days a week and cover call and be on call on the weekends and do a bunch of other stuff. You have to say no. You work your 8 hours and you're off the clock. And it is not a thing about, oh, well, good nurses do it anyway. Because the reality of this is that it's hurting patients when we do this, because we're hurting ourselves, we're burning ourselves out, we're working way too thin, we're not able to provide the care that our patients are used to and that our patients need and deserve. So to be a good nurse and to provide the good care, you have to have boundaries. So start that on day 1 as a hospice nurse. Learn to say no. That's a complete sentence. No, I'm not doing that. And those are the top 3 things. If you can get all of that together, I think you're going to be very happy and very successful as a hospice nurse. And if there's anything you guys want me to talk about, let me know. I'll share it here, and y'all be safe out there, and I love you guys.